Hi students, in last video we deals with the common terms and common concepts in psychiatry, and we deals with the history of the psychiatry and the modern and traditional views of the psychiatric illness. In this video we are going to deals with the how to assess a psychiatric patient or a psychiatric illness. So the first method of assessment in psychiatry is psychiatric interview. What is psychiatric interview? The psychiatric interview refers to a set of tools that a mental health worker, the mental health worker can be a psychologist, psychiatrist, social worker or a nurse, they uses to complete a psychiatric assessment. The purpose of a psychiatric interview is to establish a therapeutic relationship with the patient to collect, organize and formulate a differential diagnosis and treatment plan. The main purpose of the psychiatric interview is to establish a rapport, then collect their relevant data for differential diagnosis and their treatment plan. Then the main goals of the psychiatric interview. First of all, the main goal of the psychiatric interview is to build rapport. After building the rapport only, we can collect data from the patients about their current difficulties, their past psychiatric history, medical history, as well as relevant developmental, interpersonal and social history. Then we want to diagnose the mental health issues of the patient. Understand the patient's personality structure, use of defense mechanisms and coping strategies, and also to improve the patient's insight and to create a foundation for a therapeutic alliance and also to foster healing. Then next we move on to the techniques of the psychiatric interview. What are the techniques used in psychiatric interview? First of all, pay attention to both content and process. Attention to both content and process. Then open-ended questions versus closed-ended questions. Open-ended questions means they can explain or discuss, or they can share their experience, or they can ventilate their feelings in, and they can like essay, they can say more about their past life or future expectations like that. But in closed-ended questions there will be yes or no type questions only. Then reflection. In the technique of reflection, a doctor repeats to a patient in a supportive manner something that the patient has said. Reflection means the patient already said have been repeated by doctor for supporting manner. The next one is facilitation. Facilitation means doctors help patients continue in the interview by providing both verbal and non-verbal cues. In facilitation, doctor help patients to continue their interaction by verbal or non-verbal cues like okay, then what happened, like that, or okay, like that. Next, silence. We can, if they are crying or if they are expressing their feelings, we can give some time for them to relax, for the relaxation. So for 5 or 10 minutes we can make a silence in that conversations. Next one is confrontation. Confrontation means the technique of confrontation is meant to point out to a patient something that the doctor thinks the patient is not paying attention to, is missing or is in some way denying. That is, in confrontation, patient something that the doctor thinks the patient is not paying attention or is missing or in some way it is denying. That is confrontation. Then clarification. In clarification, doctor attempts to get details from patients about what they have already said. If the doctor didn't understand about what the patient said, then the doctor can clarify their statements or their problem or what they said. Next one is interpretation. The technique of interpretation is most often used when a doctor states something about a patient's behavior or thinking that a patient may not be aware of. The doctor can interpret about something that the patient is not aware about it. Or the doctor can explain about the situation or about the feelings of others or the feelings of their parents or their child if the patient is not aware about that. Next one is summation. Summation means periodically during the interview, a doctor can take a moment and briefly summarize what a patient has said thus far. In summation, here means that the doctor can submit the things what the patient already told about it. Then explanation. Doctors explain treatment plans to patients in easily understandable language and allow patients to respond and ask questions. The doctor will, after hearing all the problems, all the experiences of the patient, the doctor explain the treatment plans, and if the patient didn't understand about what the doctor said, they can ask questions to or clarify the treatment plans or what the doctor said. Then transition. The technique of transition allows doctors to convey the idea that enough information has been obtained on one subject. The doctor's words encourage patients to continue on to another subject. That means if the doctor gets enough information from one subject, the doctor can talk about the patient to tell something about that topic. If they didn't got any sufficient information from any particular problem or any particular subject. Then self-revelation. Limited, discreet self-disclosure by physician may be useful in certain situations, and physicians should feel at ease and should communicate a sense of self-comfort. That means in self-revelation, sometimes the physicians can reveal about their little personal experiences or little personal history for their patients to build a comfortness in that place. Sometimes it will be useful or sometimes it will be misuseful. So always it won't be work out. So in sometimes it will be work out. That is self-revelation of the physician. Then providing positive reinforcement, reassurance and advice by the physician. Next one is, what are the skills needed for a psychiatric interview for a psychiatric patient? First one is listening skill. Listening skill is the most important thing for the every social worker or a psychiatrist social worker in psychiatric interview, because if the patients think that we are not listening, then they will not reveal their problems, or they will not build a rapport with the, or they will not build a professional rapport with the physician or social worker, and they will not comfort to interact with the social worker. So listening skill is very important in all the psychiatric interview. The next one is communication skill. Communication skill is important because if the patient is telling something and we didn't understand about that, we want to ask questions about that topic, then how it happened, then what are the expectations, or what are the outcome happen in that problem, or like that. If we want to get more clarification about that topic, we need a communication skills. The next one is observation skills. If the patient is telling all their subjects in a very pleasant manner, sometimes they will be present their problems in a pleasant manner, but it will be all sad things, and the only emotion is sometimes the happy. So we want to observe their body language, their expressions, their feelings, and is there any connection between the topic and the emotions, expressions, or like that. Then next one is confidentiality. The patient and the doctor have a confidentiality with both their problems, their personal things and all. That means the doctor knows about their personal history, past psychiatric history, their personal details, their address, name and all. And the patient wants to believe that, and the patient wants to believe that the physician or psychiatrist social worker will not reveal their problems or their personal address, name or something like that, will not reveal to others. That makes the confidentiality between the doctor and patient. So by providing like the confidentiality, the patient become more comfortable to interact with the social worker or psychiatrist social worker. Then most important thing is documentation skills. Documentation skill is the more important in psychiatric interview, because the first interview we want to, in every section of the interview, we want to document about what the patient had said and the doctor planned to do. By that only we can refer for other strategies or coping mechanisms for their next sections. But is there any variations in interaction with the patients? Is there any topic related differences from the patient side? Is there any negative influence or any something differences we can review from this documentation? So documentation is very important, because each documentation help the doctor to make the patient improve. Then next one is different types of interview. In psychiatric interview and others interview also, there are different types of interview. First one is structured or direct interview. The questions and acceptable responses are specified in advance. In structured or direct interview, the questions and acceptable responses are specified in advance. Responses are rated for appropriateness of content. The responses are rated for according to the appropriateness of content, also called standardized interview, as they are pre-planned to a high degree of accuracy and precision. So in structured and direct interview, there will be pre-planned questions and the responses are rated according to the appropriateness of content. Next one is unstructured or indirect interview or open-ended interview. Here, not directed by questions or comments as to what the candidate should be asked. Not set format is followed. Candidate is encouraged to express himself on any topic of his interest, his expectations, background, etc. Interviewers look for traits of character and nature of his aspirations, strengths, weakness, potential, etc. So, in unstructured or indirect interview or open-ended interview, the questions are not directed and the candidate is encouraged to express their interest in any topic that they want to tell. Then semi-structured interview. Semi-structured interview, there will be specific topic areas, a general set of questions, but the interview flows like a conversation and topics are covered as they come up. There will be a topic and there will be a set of general questions and the conversations going on. The interview flows like a conversations and all the topics will be covered. Next one is group interview or group discussion. The main purpose of this interview is to how the interviewee interacts with others and how he or she influences others with his or her knowledge and reason. The main purpose of this interview is to how the interviewee interact with the others and how he or she influences others with his or her knowledge and reason. Also known as GDs, that is group discussions. A topic for discussion is given to a group. Group discussion means a topic will be given to a group, and group interview is also the best way to discover any leadership potential, group participation, team playing skills and communication skills among the clients. In group discussion, in group interview, we can discover the leadership potential, who have the leadership potential and who are participating in group and who have the team playing skills and who have the more communication skills in these groups. So group discussion is also important. Then next one is situational interview. In situational interview, this interview will focus on the individual's ability to project what his behavior will be in a given situation. That is, in situational interview, the individual's ability to project what his behavior in a given situation. The interview can be both structured and situational with predetermined questions requiring the candidate to project what his behavior will be. So we can analyze the individual's ability to project the behavior in a particular situation. Next one is behavioral interview. Here is a situation is described and candidates are asked how they have behaved in the past in such a situation. While situational interview asks candidates to describe how they would react to a situation in future. The behavioral interview seeks candidates to describe how did they react to situation in the past. In situational interview, we ask candidates to how they behave in a situation in future. But in behavioral interview, the interviewer asks them how they behave in a past if the situations comes. Next one is psychological interviews. Psychological interviews are interviews conducted by a psychologist. Psychological interviews are conducted by a psychologist in which questions are intended to assess personal traits such as reliability or dependability, etc. The questions are intended to assess their personal traits such as the reliability or dependability of the person. That's all about the psychiatric interview. Thank you.